welcome to our special show, Living Long and Healthy with COVID Vaccination. I'm Gargi Rawat. Now, this show seeks to address the concerns that you may have with regards to the COVID vaccination and living in this new normal, because the risk of COVID infections continues even though most restrictions are gone now, and vaccinations are the only way to eliminate the coronavirus risks. Today, we have with us experts to address any concerns and questions you may have regarding the vaccinations. Joining us on the show today, Dr.A.Sreenivas, Kumar, Director Cardiology and Clinical Research, Apollo Hospitals, Heart Institute, Hyderabad. Thank you so much, doctors, for taking time out and joining us on the show today to dispel any concerns that people have. Dr. Sreenivas, Kumar, do people still have to quarantine after they've been vaccinated if they come in close contact with someone who's had COVID?
Yeah, actually, as Madam just now mentioned, after somebody gets vaccinated, unless another 2 weeks goes by, his protection won't be totally perfect as expected, up to 80-90%. So first 2 weeks, after the second dose also, you need to take care and follow all the precautions, wear masks and follow healthy lifestyle, and need to quarantine yourself and take care after you finish 2 weeks period after the second vaccine. Because though you might have some benefit, but the benefit is, and the protection is not perfect till you pass on this first 2 weeks phase after the second vaccine dose. People might think that after taking first dose itself, they will have some protection, but it could be there, but not much.
Dr. Sreenivas, Kumar, now over the last year, many people have postponed various operations. So should people who are, have pending angioplasties now go ahead and get them done?
Yeah, this is very relevant, particularly to our specialty of interventional cardiology. All these months we were thinking that COVID will come down, and we did postpone some of these elective procedures. But emergency procedures in cardiology anyway, they cannot wait. So we have been following all the precautions which are to be done in treating COVID patients, and then doing the procedures. So we were doing primary PCIs, we were doing all sorts of emergency procedures in cardiology. But the elective ones, yes, what you say is what we were getting postponing before. Then probably if they're vaccinated or if the numbers are less, probably you could start doing. In fact, we did start doing cases since last 1 month. But only worry is of late we find again cases going up a little. So we are a little more stricter. But all these emergency elective procedures also, we get RT-PCR done, and we check the patients and take up for them only if they're negative. Tablets like what doctor mentioned, diabetic medication and hypertensive medications are all the drugs which are required definitely to be taken. In fact, there will be more of benefit in this certain stressful, tough times. So we recommend the patients to take all these drugs and go for these elective procedures now with proper precautions.
Dr. Sreenivas, Kumar, now, there's been a lot of vaccine hesitancy that's been seen in the country. Earlier, when numbers were coming down, people even started believing that COVID is gone, and, why do we have to take the vaccine? So a lot of people keep asking, is it mandatory for everyone to take the vaccine? What would you say to that?
Yeah, it's very important for all of us to understand this is the only method which is proven now before that vaccination works, and efficacy is also proved in the trials which are conducted with both types of vaccines. So if you ask if it is a must, then if you have to protect yourself not getting into COVID, if you like to get into infection, then probably you would avoid. Otherwise, the only thing you can avoid is presently is not getting exposed and probably getting vaccinated. And all of us should not have any fears in your mind, and definitely get yourself vaccinated. And more so if you have risk factors, as I mentioned before, like diabetes, hypertension, heart disease, heart failure, definitely yes. And we were having some doubts whether elderly people would tolerate this vaccine better or not tolerate it. But we have seen many patients who are elderly tolerating the vaccine very well. And in fact, actually, they were not getting even the minor little body pains and the focal site injection pain in elderly people. Like young. So I think that worry also is not there. Even the people who are 80 plus, we've given them vaccines, especially when they had some cardiac issue, and all of them have tolerated well and behaved well.
In fact, we should get in Dr. Sreenivas here to answer this question. Dr. Sreenivas, is there something you'd like to add to that?
Yeah, very important for all of patients who are taking the cardiac medications not to misunderstand and stop these drugs. We keep receiving a lot of phone calls saying that in the literature, I think in the brochures which come with the vaccines, it has been us. This blood thinner, what doctor said also is anti-platelet are not a contraindication. Anti-thrombotic drugs, sometimes the newer the anticoagulants also, like rivaroxaban and pixaban and dabigatran, these could have some issues, but if you avoid the morning dose, generally it is enough because they are short-acting drugs, and maybe even if they are long-acting, what we have noticed is it's not causing much of a problem. Issue was with the patients who are on prosthetic valves with dicumarol or acetro. What we have noticed is that the INRs are in therapeutic range. It's okay. Only those patients in which INR values are very high, probably you tend to get them down a little and then into therapeutic range and give the vaccine. But definitely none of the other drugs, but for these dicumarol, VARF or this Novax, rest all the drugs to be definitely continued, and patients should not get into trouble. In fact, if you stop the drugs, the stents could get into trouble and you could have problems in heart failure medications also. If they have stopped, they get more symptomatic. So it's very important. I would like to reiterate this statement that all the patients should take all their drugs regularly and without any fear of worry or vaccination should get themselves vaccinated.
All right. Well, thank you so much. And I hope that's cleared a lot of doubts that viewers have regarding the vaccination and increase their confidence in going ahead and getting that vaccine if they're eligible. Thank you, doctors, for taking time out and answering all those questions. Thank you for watching. Goodbye.